Professor 𝐿𝐶𝐚𝐴, Nawaloka Hospital has been a pioneer in the private healthcare industry, and I think you had touched millions of lives in the country. And now it's called the People's Hospital also by the people and the doctors. Now, what are the new things that you have added to your profile to serve the masses better in the country?
Yes. As you know, Dr. Amal, we have the Nawaloka Hospital was established in 1985. But the primary aim was to bring new technology and take the hospital to a higher level, which we have done right from the beginning. So we brought in the first CT scanner, the MRI scanner, and all the technology. We have been the pioneers, and we started the first coronary artery bypass grafting surgery. So from there, right up to now, we have been advancing in technology. Right now, we are concentrating on artificial intelligence, and we have brought in the first radiology center with artificial intelligence and the first scanner, which will be which will give the reports in an AI mode. Our radiology unit is the best in the country. So as I said before, we have 2 MRI scanners, 2 CT scanners, and then a cardiac scanner, especially dedicated to find out heart diseases in the early stages. So you don't have to go through a basic angiogram, but it's a very simple test. It can be done in a few minutes, and that will tell you whether you have to go to the next stage or whether you are okay. So that is a great relief, and that test is very, very popular now, and it has given good guidance to a lot of people. So in the field of cardiology, we are advancing daily. And also in other fields, we are going to be AI assisted right throughout. Paperless hospital environment. And those are the things that we are going to concentrate on. So also our financial situation, you can see from the quarterly reports that have been published, it has come out very well, and we are on the way to recovery. And in fact, we have recovered now.
Already
we are
excellent, because after doing such a lot of good work, if you can also be financially viable, is the motto of the original Nawaloka Mudalali. Exactly. I can very well remember his motto was to treat the people first and then look after the money later. Right. That was his motto. Yeah. And I think 𝐷𝐻𝐻 Dharmadas has taken this to a different level, because he was selected by the Medicare exhibition group as the lifetime achiever in medical care, because no one has touched so much of lives in the country than Mr. 𝐷𝐻𝐻 Dharmadas today. Because I think they are treating people from all walks of life, from the upper middle class, lower middle class, poor people. Sometimes you treat them free, and then also the elite of the country. It depends on Nawaloka Hospitals.
And we are celebrating the 40th anniversary
of Nawaloka.
18th of September. It's very significant that we have come all this way in 40 years. And
40 years, Lal, you had done extremely well, because basically if you touch a lot of lives when they are physically down, mentally down, and they walk out happy from the hospital, that's the best blessing can a business have
in every field.
Absolutely. And therefore I think Nawaloka Hospital comes to the pinnacle of hospitals. When no one was investing in private healthcare, Nawaloka decided to invest.
Right. Yes.
And then I think you are doing well, and then keeping up with the technology on a day-to-day basis. Yes. And I think this is the most visited hospital by doctors in the country.
Exactly. Yes.
Because
the
all the
highest
number of consultants are here, and then from different parts of the Sri Lanka, there are a lot of people coming here.
Yes.
And it's a marketplace for medical care.
There is a car parking facility.
Absolutely. That's also very important. 400 cars can be parked.
So nobody has to park on the road.
Absolutely.
So they walk in and walk into the consultation room and the ward.
Yeah, thank you, Professor 𝐿𝐶𝐚𝐴. Thank you very much for your good work, and hope that you will do better in time to come.
Thank you.
And then touch many lives in time to come.